Hi, this is Dr. Cash at Dr. Cash Miracle in Life. And today I thought I'm going to bring up a topic which we encounter quite often as well. And it's something that all of us have to face it sooner or later in life. And as doctors, at times, we may feel uncomfortable discussing this topic with our patients or our patient's family. And that is DNR, or do not resuscitate, and what he means. So typically, DNR means that just what it says, do not resuscitate. Just in case, if my heart stops or my lungs stop working, if I go into cardiac arrest, then do nothing. Do not do chest compressions, do not intubate or put a breathing tube in me, and just let me go in peace. DNR, do not resuscitate. Now, in some circumstance, obviously, we don't even have to ask that question. We automatically do it because that's is something that is unexpected, and particularly if someone who has not been uh, made known to us that they want to be a DNR. While in other circumstances, it may be appropriate. For example, if an elderly a person in their 70s or 80s or even 90s or older, and they are just in really poor health, or they have terminal cancer, and they feel that even though if they get sicker and their heart stops or go into cardiac arrest, they don't want to be revived back because they'll be back to being sick as they were before. And if they were to go, it would be okay with them. It would be okay for them. It will be less suffering for them. So they may choose to be DNR. And again, it's a topic that it's sensitive. It's a topic that it's quite necessary to be talked about so that the patient's wish can be known. But at the same time, particularly for family members, it may be difficult to decide. Okay, and so DNR, we just never know when we will encounter it. But if you haven't had that discussion with your family, I think it's a good time to do it, particularly if you have a serious illness or if you're advanced in age and you want to make your wishes known to them, so that when it comes time to the end, if certain conditions arises and your heart stop or your lungs stop, and if you just want to go in peace, you don't want to be having people, doctors pressing on your chest, putting the tube down your throat to intubate you and do all of those potentially life-saving techniques that doctors do. But at the same time, it's obviously the goal is to bring you back to life. But at the same time, well, if you do come back to life, you may never be the same person. During the whole time, you may come back and be brain dead or be severely injured, broken ribs, or other internal injuries. And so some people decided that just in case, if their health is to a certain point, and they were to go and their heart was to stop, the lungs stop, just let them go in peace. And so that they would make it known to the doctors and or the nurses, so they can inform the doctors that they want to be DNR. And usually when that discussion occurs, we will talk with them, and also they're confirmed with their family, just making sure that everyone is on the same page. And so it's an important discussion to have. And sometimes, again, it could be uncomfortable for the doctors to approach that, and or the patients and or their families. So it has to be something that has to, because it's rather sensitive, and so it has to be approached skillfully, and with humanity, with good intentions. And we, as doctors, we want to follow the patient's wish. And so if that's what they intend to, and that's what they in their clear mind, and if appropriate, with the conditions that they may have at the stage of their life to be appropriate, we will honor their wish as well. All right, so hopefully this may answer the question of what is DNR. And if you have any questions, please comment down below. I'll be more than happy to answer any question down below about DNR or do not resuscitate. Have a good day.